been the team dentist for the Minnesota Wild since 2004. That's been an incredible journey so far.
The NHL requires a dentist to be at every one of the home games. So we go and we're just there to serve the players of the Wild team and their opponents if anything were to come up that they would need.
The kid that falls off the bike has the same kind of dental injury as the guy that got knocked into the boards. So you get to see a lot of things on a more familiar basis or more regular basis that you can apply to general patient care.
We've been a part of the community for 30 plus years. So a lot of our patients have come with us through many changes. We have a lot of the patients that started with Dr. Edlin when he first opened the practice and have transitioned with us into the new building. I would say a lot of that's due to kind of the fun, welcoming atmosphere that we have here. The staff that we have just provides kind of that warm, homey feeling.
I think probably personally I really try to take kindness and empathy above all else. I feel like that's the best way to really make some substantial relationships with patients and to, I think, provide great care from there.
You know, it's fun to have them be the team dentist for the Minnesota Wild, but that's not the reason why they've grown to the success they've had. It is because of the way that they approach the patients. And I saw that from day one when I set them up 34 years ago.
We had a smaller footprint at the other office and equipment that many of the chairs were 20 years old. We had a compressor and a vacuum that were failing. Almost on a weekly basis, we had to have someone come out and do maintenance. So Patterson played a real instrumental role in helping us move. They helped our architect that I had hired to help design the layout. They helped him by getting the color schemes. They helped him by getting all the materials. So the architect had an idea of like, okay, how is this going to fit together? They also helped me enormously in the logistics of the move itself. So trying to determine when we were going to move, because there's some equipment that we wanted to keep. We had a CBCT that we wanted to bring over. We have a sterilization center that primarily a lot of those cabinetry were new, and a couple of the chairs that were fairly new.
One of the challenges was he had just purchased and installed a 19-foot ADEC 594 sterilization unit, so a linear long sterilization cabinet. In this office, it was a galley style, so we had to break it in half. And worked out great. So one side's dirty, one side's clean. I hadn't done that before, but it turned out great, and it functions well for this size clinic.
You know, from there it was, it just really kind of rolled. It went extremely smooth for a project of this size, the biggest project I've ever done in my 38 years. And it also, I would say far and away, was the smoothest project.
The equipment that has benefited our patients the most is our CBCT. It provides the information that we need to provide the most comprehensive and overall best care. It also helps us make decisions on what treatment is best for the patient. Also gives us the information that we need for such procedures as root canals, extractions, so that we can provide the appropriate care for the patient.
Having a company with the reputation that Patterson has made the investment that we made in this build out a pretty easy decision. I knew that, you know, they've been there in the past, they're going to be there in the future. This is a big investment. I wanted to make sure that I had my bases covered. So on top of that, they really over-deliver with service. I don't want to do another build out. It's not an easy thing to do, but Patterson really made it a lot better.